Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Management of polycystic ovarian disease. Weight loss is to be advised in all patients. Irregular cycles. If the patient has irregular cycles, the drug of choice is oral contraceptive pills. Low dose oral contraceptive pills, that is estrogen, less than 20 micrograms, can be given. Progesterones, like third generation progesterones, like gestodin, desogestrel, and norgestimate, are given. Fourth generation oral contraceptive pills like Denogest, cyproterone acetate can be given. This Denogest and cyproterone acetate have anti-androgenic effect. If patient refuses oral contraceptive pills, then withdrawal of progesterone is done every month. Progesterone given for 5 days and then withdrawn. This progesterone withdrawal does not regularize the cycles. It is not protective for endometrium.
So for irregular cycles in PCOS, we should give OCPs, or if the patient refuses OCPs, then every month we should withdraw the bleeding. So withdrawal is done by progesterone, but this does not regularize the cycles and it is not protective.
thank you and thank you for watching.